Hello there, this is Cameron Giardini of Giardini Medicare, where we are your transition to Medicare team. And as you may already know, one of the biggest choices to make when you are starting Medicare, or even if you've already been on Medicare, is whether or not you want to go with a Medicare Advantage plan or a Medigap plan. Well, today's video, we are going to jump into all of the details to clear up some of the confusion for what Medicare Advantage plans actually are and how they work. So without further ado, let's take a closer look and try to clear up some of the confusion.
You will often hear us refer to the fact that there are two choices when it comes to your Medicare coverage. These two options are Medicare Advantage plans, also known as Part C, and Medicare supplements, which we refer to as Medigap plans. During this video, we will be taking a deep look at what Medicare Advantage plans are. So first, what is Medicare Advantage? The Centers for Medicare and Medicaid Services define Medicare Advantage plans as all-in-one alternatives to original Medicare, and these bundled plans typically include Part A, Part B, and Part D. Medicare Advantage plans are often called Part C, MAPD, which is Medicare Advantage prescription drug plans, zero premium plans, and also private Medicare alternatives, etc. It's important to note that Medicare Advantage plans must cover all of the medically necessary procedures that original Medicare covers. However, this does not mean that the style and costs of coverages are the same as with original Medicare, which is Part A and Part B. Lastly, Medicare Advantage plans work similarly to employer and individual health insurance plans you may be accustomed to before starting Medicare. Advantage plans consist of HMO and PPO plans and often require you to choose a plan with a specific number of doctors and hospitals that you agree to use. This is a concept that matches how most insurance plans work for individuals under age 65 and are not on Medicare yet. Let's focus on what we mean when we say that Medicare Advantage plans are a bundled alternative to original Medicare. Original Medicare consists of two parts. The first part is Part A, which provides coverage for hospitalizations and other inpatient facilities and treatments. The second part of Original Medicare is Part B, which provides coverage for outpatient medical services. It is important to note that when you hear people refer to Medicare and Original Medicare, they are only referring to Parts A and Part B. Part D prescription drug coverage can then be added to Original Medicare as a way to get coverage for your prescription drugs. What happens with a Medicare Advantage plan is that these three parts, A, B, and D, are then typically bundled into one package that is provided by a private insurance company. This is why it is sometimes referred to as Part C, even though Advantage plans are not actually a part of Original Medicare. Blue Cross in this case is just an example company, and there are many other companies across the country that provide Medicare Advantage plans. The reason private insurers like them can offer these plans is that the federal government actually pays private insurance companies to offer Medicare Advantage plans to their beneficiaries. These companies receive up to and over $1,000 per month per enrollee from the government, and in exchange, they administer and manage the health care for individuals that sign up for their plans. What the insurance companies do a little differently than the government is they also provide some additional benefits not included in Original Medicare. Many of these additional benefits come built into the plan at no additional monthly cost. The first extra benefit that you may be most familiar with is the fact that many Advantage plans include coverage for routine dental, vision, and hearing care. Currently, Original Medicare does not provide coverage for any of these services, and here is an example of the typical dental, vision, and hearing benefits included in an Advantage plan. You will see there is coverage for dental cleanings, exams, and x-rays, as well as vision and hearing exams. You can see that most plans, they don't offer full dental coverage, and most plans offer more of the preventative services. These are examples in our home state of Michigan, so give us a call if you want to learn about different plans and how they provide dental, vision, or hearing benefits. Next, many Advantage plans include a no-cost gym membership, via programs like Silver Sneakers, Silver and Fit, and others that there are too many to name. An increasing number of plans are including an over-the-counter benefit that gives members the ability to purchase their over-the-counter items using what is typically a quarterly allowance in the form of money that you can use to purchase these items. The products include allergy meds, vitamins, cough drops, and many more. Lastly, many Advantage plans provide coverage for a yearly physical exam as well as emergency coverage if you travel outside of the United States. Let's take a quick look at what we mean by a physical exam because this is something that confuses a lot of Medicare beneficiaries. You can see here that Original Medicare does cover an initial welcome to Medicare visit as well as an annual wellness visit. However, Original Medicare does not provide coverage for routine physical exams, which is a little bit different than the annual wellness visit. We'll have more videos on this topic in the future, but essentially a routine physical is more comprehensive than a wellness visit and includes actual diagnostic testing. The more comprehensive physicals are typically covered by Medicare Advantage plans, as you can see here in this plan's summary of benefits as an example. So we have talked a lot about the benefits included in Medicare Advantage plans, but now let's look at what these plans actually cost. And there are two very important things to consider when it comes to the cost of the Medicare Advantage plans. The first cost is the fixed monthly cost you pay, which is referred to as the monthly premiums that you pay to the company every month to have the actual coverage. If you enroll into a Medicare Advantage plan, it is important to remember that you still have to pay your monthly premiums for Medicare Part B. We have other videos highlighting the cost of Medicare, but here is a chart showing what Part B will cost you based on income. Typically, for this video, we will use what most Medicare beneficiaries pay, which is $144.60 per month for their Part B coverage. Again, that is just the cost of Part B. The monthly premiums for a Medicare Advantage plan would be in addition to the $144.60 per month. And you can see here, this chart from the Kaiser Family Foundation shows the national average for Medicare Advantage monthly premiums. And you can actually see that the overall trend for Advantage premiums has been decreasing recently, and the average monthly cost in 2019 was down to $29 per month. With all that being said, you are probably much more familiar with Medicare Advantage plan advertisements looking a little bit more like this. More than ever, zero premium plans are becoming more available and more popular among people that choose Medicare Advantage plans for their coverage. Remember, in the beginning, we talked about the fact that the government compensates insurance companies on average $1,000 per enrollee per month to offer Medicare Advantage plans as an alternative to Original Medicare. We often get questions like, how can it be zero? What am I missing? Well, those compensation rates are exactly what makes it possible for insurers to offer and advertise plans for zero monthly premium. Just remember that if you enroll in a zero premium plan, you still pay for Part B, which again is likely $144.60 per month. So we talked about the fixed monthly premiums associated with Medicare Advantage plans. Now let's take a look at the potential out-of-pocket costs associated with those same plans. These out-of-pocket costs consist of medical copays and coinsurance, as well as copays for prescription drug coverage. Just remember that prescription drug coverage is often included as part of the bundled coverage with Advantage plans. However, this does not mean that you pay nothing to get your medications filled at the pharmacy. First, here's a chart again from Kaiser Family Foundation that shows the average maximum out-of-pocket nationwide being $5,059 per year. These numbers only apply to approved medical procedures during the year and do not include prescription drug costs. I know this is confusing, so let's take a closer look at Medicare Advantage premiums and out-of-pocket costs. Medicare Advantage plans are different nationwide, but here are 5 examples of actual Medicare Advantage plans available in Michigan so you can see what these plan details actually look like. At the top of the chart, again, you can see the fixed monthly premium you have to pay for the Medicare Advantage plan. And like we talked about already, many of these plans are available at a very low premium or even zero premium. In addition to the premiums, here is a list of out-of-pocket costs that you may incur with these example Medicare Advantage plans. You can see that the max out-of-pocket in these plans are very close to that national average of $5,000 per year for approved and covered medical procedures. Let's take a quick look at an example of how Medicare Advantage costs can occur during the year. First, we will assume the Part B premium is the base rate of $144.60 per month, which would be $1,735 per year. Next, we will use Advantage Plan number 3 for this example, which has a monthly premium of $0 per month, which again is also $0 per year. Next, let's assume you see your primary care physician 2 times during the year, each visit with a copay being $0. In addition to the primary care visit, we will assume you visit a specialist like a cardiologist or a dermatologist 3 times during the year. Each visit comes with a copay of $40, and 3 visits would add up to $120 per year. In addition to the doctor visits, we will assume someone spends 2 days as an inpatient in the hospital during the year. With Advantage Plan number 3, you would pay $325 per day for the first 6 days you are in an inpatient setting at the hospital. In this example, the 2-day stay would result in an out-of-pocket cost of $650. Lastly, let's assume you also had 5 physical therapy sessions throughout the year. With Medicare Advantage Plan number 3, each PT visit costs $40, so 5 visits would cost an additional $200. Now, let's add this up and see what the actual plan would cost in this example for your out-of-pocket costs during the year. And as you can see here, they would add up to $2,705 for the year. Also, remember we talked about the fact that prescription drug coverage is included in most Medicare Advantage plans, but that does not mean your medications will be fully covered and you pay nothing. Here's an example of drug coverage included in a Medicare Advantage plan available in Michigan, and you can see here that although some low-cost generics are $0, there are plenty of brand name medications and specialty medications that could cost hundreds of dollars out of your pocket. Also, it does bear repeating that the prescription costs do not count towards the yearly maximum out-of-pocket for Medicare Advantage plans. The moral of the story is that despite all the advertisements, there are not going to be any plans that are really $0 and zero worries. This does not in any way mean that Medicare Advantage plans are a bad thing. It simply means you have to pay attention to all the details, and again, we are here to help you with that. So we took an in-depth look at the costs of Medicare Advantage plans. Let's take a brief look at the 3 main types of Medicare Advantage plans. And these 3 main types are HMOs, PPOs, and other plans called HMO-POS. Now, HMO stands for Health Maintenance Organization, and you may be familiar with this term from your past employer health insurance. HMOs typically require referrals from your primary care physician to seek care at a specialist, and you need to choose your PCP when you enroll in the plan. HMO plans usually don't include out-of-network coverage except for emergencies, nor do they usually have a max out-of-pocket for services that you receive outside your plan's network. All of these restrictions with HMO plans are typically a trade-off for having lower out-of-pocket costs when you do use the plan in-network. Next, let's take a look at the HMO-POS plan. This is also an HMO plan, but it has a point of service option. Essentially, these plans typically have some more limited networks like the HMO plan, but they do allow for members to seek medical care out of network as long as they receive prior approval and it is coordinated by their physician. So seeking medical care out of network, though, with these plans will still likely come with higher out-of-pocket costs. Finally, let's take a quick look at PPOs, and PPO stands for Preferred Provider Organization. These plans usually have the most flexibility out of the three Advantage plan types. You can see here that you typically don't have to choose a primary care physician or receive referrals from one in order to see a specialist. You can also seek care outside of your network without prior approval, but it will still come at a higher out-of-pocket cost. And lastly, many PPO plans do have a max out-of-pocket for medical procedures that you receive outside of the plan's network, unlike the HMO plans we talked about. Now, it is important to point out that even with a PPO plan, members do not have unlimited flexibility to seek care at any facility they choose. Facilities can still choose to not see patients that have Medicare Advantage plans, and they do not have to accept the terms of every plan. A famous example of this is the Mayo Clinic, and this is directly from their website. You can clearly see that the Mayo Clinic in Arizona will not treat individuals with Medicare Advantage plans, and they won't see you on a self-pay basis either. Now let's talk about some important considerations that you should keep in mind when trying to decide if a Medicare Advantage plan is right for you or which Advantage plan may be right for you. The first consideration, in our opinion, is the most important consideration to make when choosing an Advantage plan, and that is to make sure that you pick a plan that includes all of your doctors and hospitals where you seek medical care. It is also very important to note that if you ask a doctor's office or hospital if they are in network with your Advantage plan, you cannot just ask, "Do you accept Medicare?" You must clarify and ask if they accept XYZ Medicare Advantage plan offered by XYZ insurance company. Now, insurance companies provide directories with long lists of doctors and facilities in their networks, and you can go to many websites to see which plans include your doctors. The easiest thing to do is just give us a call. We can help determine which plans networks fit your needs. Perhaps equally as important is making sure the Advantage plan you pick also covers the prescription medications that you take on a regular basis. Insurance companies also provide lists of covered medications, and you can also use Medicare.gov to find this information. But just like the last part, if you give us a call, we can help you navigate this process. You can see that picking the right plan is more than just going with the cheapest plan from a company you're familiar with. We are independent insurance agents for a reason, and this is so we can work with all of these plans to find the best one to fit your needs. In addition to making sure your doctors and hospitals are in network, it is important to understand that insurance companies can actually change their networks at any time during the calendar year. Here are some headlines over the past couple of years showing how networks are not guaranteed to stay the same. Additionally, you can see here directly from Medicare.gov, they point out the fact that networks can and do change. Even though you can't change your plan mid-year, the networks can. Another consideration to keep in mind is that you need to look at the plan as a whole and try not to get too caught up in some of the extra benefits that plans offer. Some plans cover more dental and vision coverage than others, but that doesn't do you any good if your plan does not cover your doctors or medications. If you do choose a Medicare Advantage plan, it is important to know that there are additional products that can help cover some of the largest out-of-pocket costs with most Advantage plans. You can see here that inpatient hospital stays and cancer treatments like chemotherapy tend to have the highest out-of-pocket costs and leave consumers with the most risk. Fortunately, we do offer cancer insurance and hospital indemnity plans that can help reduce your exposure to these costs. Check out some of our other videos about these products, or just give us a call if you do have more questions on that. After everything we've discussed in regards to how Medicare Advantage plans work and important things that you should consider in picking a plan, let's look at the various pros and cons with Medicare Advantage. Let's start off with the pros of Medicare Advantage plans. First off, like we have already discussed, Medicare Advantage plans typically come with low monthly premiums, and oftentimes you can find plans for zero premium. In addition to low premiums, if you're someone in good health or you're someone that does not seek medical care often, you can potentially save a good amount of money during the year if you don't use your coverage. On the chart we looked at earlier, we highlighted many of the out-of-pocket costs with most Advantage plans. So if you don't receive medical care or you don't actually pay those costs, there isn't going to be that added out-of-pocket cost. Obviously, insurance is never for the best case scenario, so that is only a positive if you don't use it. But if you do need to, we'll get to that a little bit later. Another pro is that many Advantage plans offer additional benefits at no additional cost. This chart from Kaiser Family Foundation does a great job of showing what percentage of Advantage plans offer what benefits. You can see here that gym memberships as well as dental, vision, hearing benefits tend to be the most widely offered. Medicare Advantage plans also tend to have stable premiums year over year, and during recent years, premiums have even begun to decline, which is in contrast to Medicare supplement plans or Medigap plans that tend to have premiums that generally increase every year. Now that we had covered the pros of Medicare Advantage plans, let's take a look at the cons associated with these plans. Perhaps the biggest downside to Medicare Advantage plans is the fact that they come with more limited networks for doctors and hospitals compared to Original Medicare with a Medicare supplement. You can see here that Original Medicare is widely accepted among physicians at close to a 94% rate. In contrast to that, this chart shows the different acceptance rates of Medicare Advantage plans among physicians. Some of the broadest plans may be accepted by a large percentage of doctors, but you can see that there are many narrower network Advantage plans that may include only a quarter of physicians in a given county around the country. In addition to the narrower networks, you can also see that going outside the network comes with higher out-of-pocket costs than staying in-network. This Advantage plan, for example, requires that you pay 40% for certain out-of-network procedures compared to a lower copay for in-network procedures. Another con for Medicare Advantage plans is the fact that Advantage plans are a system of managed care. So what does this actually mean? Well, Phil Moeller, who is a PBS Medicare contributor, describes this system pretty well, so I'll use his words for it. But because the insurance company administers your Medicare benefits, they may be able to determine how you seek care. Medicare Advantage plans do have to cover the same procedures as Original Medicare, but they do not need to cover them exactly the same way. An example of this could be that your Advantage plan will cover a surgery or procedure, but you may have to try lower cost alternatives or seek prior approval and possibly even make appeals if your initial approval was not accepted. Another example of managed care is with treatments like physical therapy, where the insurance company can actually cap your total amount of therapy visits, whereas with Original Medicare, on the other hand, they have more of a soft cap for physical therapy, and the therapist can go beyond that if they determine your treatment is necessary, a little bit easier than if you have a managed care style plan like a Medicare Advantage plan. We talked about how having good health and low usage can create excellent savings, but obviously on the opposite side of that spectrum, if you require more medical treatments, your out-of-pocket expenses can and likely will increase with a Medicare Advantage plan. Fortunately, Advantage plans do have a max out-of-pocket for approved treatments, but there is no doubt that $5,000 out-of-pocket can be a huge hit for many retirees. Also, it is worth repeating that prescription drugs are not included in that max out-of-pocket figure. The fourth con, in our opinion, is the fact that prescription coverage and medical coverage are linked with Medicare Advantage plans. Now, you may be asking, why is this a con? Well, it simply means that you have to find a plan that fits the unique needs of your doctors and hospitals, as well as the prescription drugs that you also take. Some plans may offer excellent drug coverage, but with a very narrow provider network, or a plan may include all of your doctors, but it may be a poor fit for your medications. Also, what can happen is that if your doctor changes or your medications change, you may have to change your entire Medicare Advantage plan to accommodate it. Again, Medicare Advantage plans are a package deal, and you have to find a plan where all of the benefits meet your needs. The last con we will talk about is that if your health changes in the future, you may have more limited options when you want to change. Like we mentioned in the beginning of this video, the two main choices for Medicare coverage includes Medicare Advantage plans or Medigap plans. You can see here from the official Choosing a Medigap Policy booklet that the best time to buy a Medigap plan is during your Medigap open enrollment period, which occurs when you first start Medicare Part B. After this time period, you may have more limited options moving forward. Therefore, if you have a Medicare Advantage plan and your health changes, you may have a smaller amount of choices in your insurance options in the future. We cover the differences between Medicare Advantage and Medigap plans in great detail in our other videos that you can watch by clicking on the button in the corner of the screen right now. Please make sure to watch those before deciding which plan is best for you. Okay, so we finally have made it to the end of our video about what exactly Medicare Advantage plans are. Let's do a quick recap for what we talked about. Again, Medicare Advantage plans are one of the two main coverage choices when you are already on Medicare or just getting started. It is important to take time to understand how these plans work. Advantage plans are all-in-one bundled alternatives to original Medicare. Private insurance companies provide these plans, and they combine Medicare Part A, Part B, and Part D coverage into one singular plan. Most Advantage plans come with low to no premiums, but also have potential higher out-of-pocket costs should your health conditions change or worsen. It is critically important that should you choose a Medicare Advantage plan, you find a carrier and a plan that includes your specific doctors, hospitals, and medications. Lastly, like we have mentioned before, if you are starting Medicare or looking at options for the upcoming year, you should always compare Medicare Advantage coverage to Medicare Supplement coverage to find out which option best fits you. Make sure to watch our other videos for more information about the two plans. As always, if you have any further questions, give us a call and we are always happy to help. Thank you for taking the time to watch this video and have a wonderful day.